mom's a nurse.
Okay.
So yeah, my mom's a nurse. Growing up as a daughter of a nurse, it's another experience altogether, and it's an interesting one. But I fail to understand how nurses can be empowered. In this instance, are you asking for better welfare for nurses across board, or are you asking that there's empathy also when you're relating with nurses? What does it mean to empower or support a nurse?
Okay, to empower a nurse, we're not just talking about providing welfare for us. Supporting a nurse has to do with hearing our voices in healthcare issues that actually matter. It also has to do with creating, or should I say, taking into cognizance their mental and emotional well-being.
Right.
Empowering a nurse has to do with opening them and also providing better pay for them, fair compensation for them for the work they do, providing safe working environments. There are a lot of nurses that even where they are posted, you understand, the environment is not safe. Even the hospital is a very toxic environment. So when we are talking about empowering a nurse, we are talking about ensuring that those things are put in place in order to make nurses. And most times, empowering a nurse is just not for the present; it's also for the future. Because empowering a nurse is to enable them to save more lives. And when lives are saved, it strengthens communities, and not just communities, even the nation as a whole. So I feel that's what the empowerment is talking about.
Okay, do you agree, or we go to having...
Yes.
I'd like to, Nurse Mary, I'd like you to share an unforgettable moment in your career, something that you remember, you're like, this is exactly why I became a nurse, and it excites you all the time.
Okay. I would like to explain the recent happenings that happened in my facility. I had a patient that came in. She's heavily pregnant, and she had some issues or complications during the pregnancy. And all through that period, she was in admission. We cared for her till delivery. After delivery, she still has some complications, but we are always there for her. Right. So as of the time of her discharge, she just said she thanked God she came here, she thanked God she met nurses, and she celebrated the nurses before even being discharged. So it was a memorable moment for me as a nurse, and it's an unforgettable moment for me because the woman will put a smiling face for her, and her relatives were all happy after the treatment given to her.
Absolutely. It must be rewarding to have these experiences every day. You want to share one?
Sure, there are actually a lot. But for me, I was first a midwife before I went into nursing. So, the aspect of maternal and child health, there are cases where we meet women who come in with complications, and most times we are the first contact. So most of the time, when that fear and uncertainty comes, the ability to be able to help them and then inform, work also with our various professional colleagues, in order to produce that care. And then at the end of the day, they come out with positive results. They give birth, the baby is doing well, the mother is doing well. It tends to, in a way, it makes you feel happy and accomplished as a nurse. So those experiences, and then even as a nurse, we come in contact with patients who are, having like a case of cancer now. Those are having like critical conditions. We tend to be with them even from the moment they start, experiencing those symptoms. So we are the ones that are there to encourage them. So generally, what I'm saying is that the opportunity is actually
Wow, that's nice. But I mean, you experience a lot. This isn't just here we are discussing the good part where it turns out well. Often it doesn't turn out well. What would you say it does to your mental health? Because as a journalist that has to report a lot of stories, I don't think we take time to care for ourselves and our mental health. But do you think it takes a toll on nurses, and how do we prioritize mental health so that at all times you have all it takes to be warm and empathic towards these people that you definitely will meet every day?
Well, to answer the question, it's never easy having to be with a patient from the moment they come to the hospital, knowing that they are going to lose their life, or knowing that their condition cannot be cured. And also in cases where we experience like deaths and all, it definitely takes a toll on us, especially for nurses that have that close relationship with them. So most of the time, the most important thing is having a coping mechanism, having a way to cope with certain things. Because if, as nurses, me personally, the way I cope is that, okay, I already know that there is something going on and something might happen. So I tend to create that relationship and then also talk to the patient, encourage them, ensure that the period of time that they are still alive, they tend to make peace with themselves and all. So even when such things happen, we know that they are in better places, and also we also go back to our families who are there, our support system who are there to actually help us to, recover from that kind of experience.
What's your coping mechanism for times like that? Because you must have one, and for some of us in essential sectors, you must have a coping mechanism.
Yes, for me, the coping mechanism I have when such cases happen is just to relax and reflect back, and also at times when you know that certain events will happen, you are prepared the mind of the relative, especially who has been with the patient for weeks, months, or days, and then you prepare them emotionally of the incidents that is about to happen, and then when it happens suddenly, they will be able to cope with it. And for me, it's not really easy to lose a patient or to see a patient that come to your facility well and healthy, and then he's no more. It's really takes the grace of God, because it's not easy to lose someone. So we have to be empathic to them when such events happen.
Absolutely. So, we go for a short break now. We're going to have into this conversation. We go for a short break. When we return, it will be time to discuss the myths around nursing. What is it that Nigerians or the rest of us do not know that we should know about nurses? We'll be right back. This is RAZEP Africa.
Welcome to RAZEP Africa, the heartbeat of the continent in one show. Here, we celebrate Africa not as a headline, but as a home full of ideas, courage, flavor, and future. This is where we talk about everything Africa. The politics that shape our nations, the innovations that shift our economies, the culture that colors our lives, the challenges we face with honesty, and the victories we are building one story at a time. On this show, no topic is swept aside. We are unfiltered and we are intentional. We bring you experts from across the continent and the world. Voices that know, voices that live the African experience, voices that are shaping the next chapter of our story. Let your spirit rise. We don't just tell Africa's story, we own it. Join Joy Asonye on RAZEP Africa, Monday to Friday at 11 a.m. to 12 noon on Global Television.
Welcome back from that. We're discussing the International Nursing Week, and we'll be having a fun time discussing this with patients Ese and Ife Mary Omale. Thank you, ladies, for being here. So let's go to the myths. A lot of Nigerians or a lot of people, there may be things we do not know. What are some misconceptions that we don't know about nursing? Because one is that when a male nurse, that's the one that a lot of people do not know, the profession is open to males. When you get to a hospital and a male nurse approaches you, you're like, no, I'm looking for a nurse, not a doctor. Yes. So what other misconceptions do you often in your work face that we don't know?
Yeah, some of the misconceptions, just as you said, like when you go to, especially our northern parts, they are very strict about it. Yes. So when you have a male nurse, it's very difficult for him to penetrate or render his nursing services to them because of his gender. And even the men, that is, they don't allow the male to access or care for their loved ones. So that is one of the challenges. And another challenge we also face in nursing is that they see all nurses as maybe following doctors about and all of those things. So
like you just follow doctors.
Yes.
But what are the independent roles that you play? Because all we see is give me the specular or whatever I feel medical. Yes. Give me this, and that's what seems to happen. Take our vitals, and that's what we see you run around do. Yes. What are the independent roles that you play?
We have a lot of independent roles. We are not to carry tray and all of those things to follow doctors. The doctors make prescription. We nurses administer the drugs based on the prescription. We give emotional support. We give physical support. Every other support. We are evidence based, and our care is individualized. You care for your patient based on the individual symptoms he's presenting. So we are basically working independently based on the patient's presentation, and so those vitals of the patient, we independently check them, and all other things boil down to the nursing profession that we do as nurses.
You want to share any myths that we often have misconceptions about?
Misconceptions too is that there are actually patients who feel like we cannot give. What if it's not a doctor, they are not interested in actually listening to us or anything, and they feel like because we are nurses, we always have to wait for the doctor to actually do things. Yes, it's actually necessary there, but there are times that we actually make independent actions. Like nurses now, we have our own procedures that are lined out for us. So even in cases where the doctors are not present, when we see that the patient actually needs this, as long as it's not going to have a negative effect on the health of the patient,
right,
of course we usually carry it out.
Okay.
Yeah.
So what kind of support or empowerment do nurses need from government, for instance? When you look at the nurses, not just in Abuja clinics, because people are the big boys. But when you look at your colleagues that work in other public institutions or rather public facilities, what necessary support would you say? Listen, I've seen this, it is bad, and it's only government that can come in here and support.
Yes, in the healthcare system, there's a lot of support that is needed. Like in terms of rural communities, they need infrastructure, healthcare. Most of those don't have accessible and affordable healthcare. So, and then in terms of staffing, also there's shortage of staffing. So, the government, if they can improve on staffing and also remuneration, the nursing healthcare delivery also needs more of remuneration. And then also security-wise, we need security, because most of those states there's insecurity, which boils down on the health workers. So security also should be provided, and also a conducive working environment. And probably if more equipment can be provided to health facilities to be able to carry out these demands and responsibility for our patients.
Okay, also I want to add also the input, like she said, the aspect of equipment for better infrastructure for healthcare, because there are hospitals that when you walk into them, they don't even have the basic things that are needed to assess the patient's health status.
Oh wow.
Also, if it's possible, the government can liaise with our nursing bodies for them to provide mental health support programs for us nurses. If it's possible, we really appreciate that. And then leadership opportunities for nurses.
And continuous education, continuous training and education,
professional development for us. They can organize seminars, work with our nursing bodies so that nursing can be improved.
Right. So recently, Nigeria recorded a lot of exodus of professional medical professionals, healthcare professionals who left the country. Congratulations for staying back. Thank you for not jackbarring. However, do you think it has put a strain on the healthcare system in Nigeria? Yes. And what can we do to, why did you stay back? Why are you not considering? I'm hoping you're not considering. So what can we do to encourage more people to stay back and fill in those gaps? It got so bad that some hospitals were recording a lot of people leaving, especially nurses, really, leaving their country.
Yes, one of the things that the government should do, just as we have said, those infrastructures, the remuneration, staffing, and all of those things, if they can be provided, these are some of the things, or one of the major things. People are looking for greener pastures. That is why they are. So if those things can be provided here in our country, we can do better than even where they are going to. And we decided to stay because it's our country, and if all of us should leave, there will not be development in the country. So if our government can be able to consider those things and put them in place, the Jabari syndrome.
Okay, so for a young girl watching us now, I'm thinking, oh my goodness, I want to be like the ladies I'm seeing on TV. What would it take for me to be a nurse, just like Nurse Patient or Nurse Mary? I would like you to start. What would be your response to a young girl listening to you in awe? This is what I want to be in future. What should they do? What should they expect? How should they prepare for the career?
So firstly, I want her to first take time and know why she wants to be a nurse. Why do you want to be a nurse? Nursing is a calling.
Right.
You don't just go into nursing. You need to have that passion for it. And also you must be willing to put in the work, you understand, to be a nurse. It's not easy, the journey is not easy, but when the passion is there and the work is there, at the end of the day, you will find out that nursing is an amazing discipline, it's an amazing job. So as a nurse, it's possible to be a nurse. Just ensure that you have a reason for actually wanting to be a nurse.
And I made a mistake. Did you notice that I said a young girl? I fell into that same trap of always, when you think a nurse, the first thing that comes to mind is a woman, is a girl. So if this today's episode does anything, it should be that you know that as a young boy or a girl, you can be a nurse as well. So what's your own response to a young person watching you and saying, this seems like a profession I am endeared to and something I want to do?
Okay. For someone that is endeared to and you want to be, not just because many people now are coming into nursing because of the money, because of I want to be a nurse, I want to travel and all of those things. So if you want to become a nurse, you should be focused and you should also have that passion and always have that mind of ready to render your care to the humanity. And then in the nursing school, it's not easy. But if others can do it,
I know nursing school stressed a lot of my cousins. They never got the entrance right for some reason.
Yes.
They were, and that also, would you say that in Africa we're doing well enough when it comes to contemporary curriculum for nurses, just so that it meets international standards? Have you had conversations with colleagues from other parts of the world and you're like, no, they did not teach me this one, or we are just as good?
We are good.
We are good. And I think from even school, you find out that they do review the curriculum for every session. So there are times that maybe a person can be in year 1 and you're in year 3, and then you're hearing that they actually did courses that you didn't do, and then you have to still do it in year 3 because it was reviewed. So I found out that they're actually making plans to actually implement some of the things that are being taught outside here.
So let's address something. Every hospital has that Manos. She's probably not even the matron. No. There is one Manos that is so mean. Tell me about Abuja Clinic's Manos. She's watching, isn't she? Okay, let's not go there. Before we now get to know who the Manos of Abuja Clinic is. But there's something about nurses as well. They are known to be the cleanest. And growing up, they were like angels because they wore white. Lately, I see checkered colors and all of that. What's going on? I mean, the picture of a nurse I grew up with was the white, and then the it's not a baronet, what's it called? The nightingale, right? And that picture was like an angel is coming to your aid. What's going on with the dresses these days? I'm seeing nurses wear trousers all over the place, and they are wearing, I mean, not even scrubs, but they have uniforms. Some of them are like, what's going on? Is it the 21st centuryness?
Should we say it's something more like innovation?
Is that innovative?
It's also part of innovation, and also sometimes from like where I schooled or came from, most of the nurses there are scared because generally public know us as wearing white. So once you see a nurse, you know that this is a nurse.
And what's wrong with that?
This period now, nurses disguised.
Why?
Insecurity. Once they see you on white.
Are nurses targeted per se?
Yes.
Why?
You know, the notion that nurses have money. That's the first thing.
Yes, apart from that, also like, they feel like these insurgents, all these, they pick nurses to treat them.
Okay. Oh, wow.
So most of the nurses are being kidnapped and taken to those places.
But this isn't just in Nigeria. I mean, the change of attire is not in Nigeria. It seems to be global, because I've also seen in other parts of the world where the nurses are no longer wearing white, and I'm like, what happened to our nurses?
It's part of the innovation.
It's innovation. But let's address this issue of insecurity and the targeted crimes towards nurses. Beyond the one you mentioned, where sometimes you're kidnapped so that you could serve as let's talk about other subtle targets that you face because you're a nurse.
Well, aside what she said, I know, because most times when you communicate with people, they tend to tell you that.
And yes, some people have a lot of money, but
yes, you're doing well for yourself. You're doing well for yourself. So most times, I feel maybe that's why most times nurses are targets, because once they see you with that uniform, they can tell that yes, there is something that can come out of you, and all. That's just what I can say. But aside that, I don't really.
Yeah, but there's something about nurses too. There's this reverence. You get to a space, you tell them I'm a nurse, and all of a sudden, like, oh my goodness, it's this reverence. It's like you're already going to make heaven. You don't. There's no wrong thing with nurses. But let's also mention you mentioned equipment in underserved communities. Yeah, in underserved communities, sometimes you go to those places and the nurses are like, I can't even go there at all. I've also seen nurses who stretch it. You know, they go to communities, they don't even tell them they are nurses, they make them tell them they are doctors. Yes. I've been to several instances where, the doctor treated me, and you're like, let me get to meet this doctor, because of course I would ask questions, and you get to find out that she's a nurse and she's doing. How do we curb that, especially in underserved communities where often they don't even have access to good medical services, and their primary healthcare facilities are dilapidated, and I'm being very kind, So that's how do we solve this? Where they go to those places and act like they are doctors, they are treating, they are prescribing, and all that.
Well, what I have to say is we nurses, we've been trained to improvise, and we've also been trained to work with limited resources. So as nurses, even when we are being posted to places like that, we try our best to make use of the
available resources.
Yes, we try to make use of what we can do, and also we try to health educate them, because we need to at least promote their health so that it will even limit the number of morbidity. That's the number of people who fall sick, so that even when we have the chance to manage those that are sick, we can be able to, attend to them. And also, this is where we are also talking and also, begging the government to also find a way to also help and assist in those areas.
But where for people listening and wondering, where does your job start and end? Because people are mistaking you for doctors. People ask, and this, some of them don't even get to say, no, I'm not a doctor, I'm actually a nurse. But where does it start and end? My mom, we used to tease her a lot. If you call my mom to say, listen, this is how I'm feeling here, this is how I'm feeling here, she will send you to the doctor. She will tell you to go back to the hospital, get to the nearest hospital. And we're like, exactly what is your own job now? If you would end up still sending us to the hospital, are you sure you learned this thing? So where does it start? Where does it end? And for people who mistake these nurses for doctors and depend on you, what should they know in depending on nurses like that?
Okay, what they should know, depending on nurses, is that your health is a major priority. So once you are sick, even me as a nurse, if you come to my house and tell me you are sick, the first thing I will say, have you seen a doctor? Have you gone to the hospital?
Have you run a test?
Have you run a test? So the main reason why we ask or we advocate you go to a hospital is because there are some tests that should be run before you are being treated, not just treating you blindly.
Exactly.
So because most of people just go to the health chemist and just get drugs, self-medication, which is not advocated. So in such instances, you go to the hospital, you run tests, and from the test results, you'll be treated accordingly instead of treating you blindly. So our nurses, our work starts from when the patient is being admitted till when he's discharged home, sound and healthy.
Right. And so for around your community, when people come to you to say, listen, I am feeling here, what should a nurse, a professional nurse who knows their ethics, do?
Yes, a professional nurse, like in the community, as you rightly said, if there are primary health care centers, which is the first
point of call, right?
Point of contact, you go there, or you follow them there, you do a follow-up, you go there and ask them what the problem is. And if it is a case of referral, you refer to the secondary or tertiary institution. But we don't provide care directly to patients without referring them to health facilities.
Right. And you want to add something?
Oh, and also I will say from also our experiences, there are some cases that can come that we are sure we can handle.
Absolutely.
You understand? So most time it takes also the level of experience of the nurse. That's why if you see a condition and you're not sure of it, the best thing, like she said, is to refer for proper management. And then we also provide first aid as usual. So when they come, if we feel we can provide that first aid for them,
just to stabilize before you go to if it's a tertiary facility that this person may need. So as we celebrate this International Nurses Week, what message would you like your patients, would you like Nigerians to take away from this year's theme? What is, beyond, I know that Abuja Clinics constantly does this awareness for individuals to know and celebrate these international days. However, what else would you want people to know, and what have you been doing to celebrate it? Are you people, I don't want to come to the hospital. We used to threaten people with our children, like, I will call a nurse. You're going to get an injection. So I'm thinking of how you're celebrating this Nurses Week, and I'm saying, I hope you are not giving out injections.
No. We are not giving anti-injection, and to the general public, I want to say that we should take our health as a priority. Our health is very important. Let's always go for checkups, and which is always been neglected. They always want to rush to work, look for money, and then the health is always neglected. So let's always go periodically, 3 months, 6 months, 9 months, 1 year, you go for routine medical checkups and be able to get your health status. And also we should avoid self-medications as a general public, and then we should prioritize our health. We should eat well and stay healthy.
She has actually said everything, but then also we just want them to also support us in any way they can as nurses, because nurses are humans. So we should also be seen, we should be respected as nurses and all. Also, we want our healthcare leaders also to also try to provide those necessary, resources and all that will make us be able to work proficiently as nurses. So that's the advice we're saying.
Okay, so finally, what would, in one word, describe a nurse?
A word.
Okay, maybe not in a sentence. In one sentence, describe a nurse.
A nurse, compassion in action.
in action. Is that something, or you just came up with it right now?
I just
Wow. Compassion. What, in your one sentence, describe a nurse?
A nurse. A nurse. In one sentence, a nurse is a person who has dedicated her time to want to see to want to improve the welfare of the people around her, whether sick or well. So I think that's what I'm going to say.
Okay.
Who puts in the necessary resources to ensure that the person is fully. Yeah.
So before I let you go, ladies, I would like you to address fellow nurses listening to you right now. In your words, knowing what your challenges are, and they are peculiar across board, what would you, as a form of encouragement, use this opportunity to say to fellow nurses who every day do their best, to double in family, their mental health, emotional health, physical health, and still have the need to care for another human being?
As for our patients, for our colleagues out there, we want to say thank you for always there for our patients. You run shifts, morning, afternoon, even night shifts. You dedicate your life to save. So we want to say a big thank you, and we want to encourage you, don't give up. Continue to be resilient, to be compassionate and caring for your patient, because it's rewarding.
Also, we want you to know that we are more than healthcare workers. We are protectors, we are advocates, we are counselors, and we should not relent in doing what we are supposed to do. We know how hard it is, but let us not stop being who we are, and let's continue to render that care for the people we love, who are our patients.
Thank you, Nurse Ese, patient, and thank you so much, Omale Ife. Thank you so much for being part of today's edition of RAZEP Africa. We've been discussing the International Nursing Week 2026. Thank you, ladies, for being part of this.
Thank you.
Right. And this is where we end today's edition of RAZEP Africa. I hope you've learned so much about being a nurse, what compassion and sacrifices these individuals do every day, just so that the rest of us are better. Until next time, have a wonderful day.
Bye.